As Dan Pack mentioned, I'm going to speak about restorative stimulation, stimulating the L2 medial branch nerves to restore function of the multifidus muscle. Why do we focus on the multifidus muscle? It's the primary stabilizer of the lumbar spine. It's a key sensor for proprioceptive input, and I'll show you how important that is. It's controlled involuntarily. So you fire your left, if you lay on the floor like Superman or Superwoman and you think about raising your right arm off the floor, when you think about doing that, you fire your left multifidus involuntarily to stabilize your spine, or you should say it fires involuntarily. So the patients, on average, were 47 years old. On average, they had a history of 14 years of low back pain and pain on 97% of the days in the prior year. 100% of them had failed physical therapy. On average, they'd been to 31 physical therapy sessions. 100% of them had failed pain medications. 37% of these patients were on opioids.